Good morning for everyone. This video is going to talk about dissociative identity disorder, in other words, multiple personality disorder, by Itzel Lopez de Yergo and Andrea Lam. What is a disorder? A disorder is a disruption of the disease to the normal or irregular functions in the body or a part of the body. For example, a disorder resulting from the cardiovascular disease is an arrhythmia or irregular heartbeat. An arrhythmia is not a disease itself, it's an abnormal heartbeat that occurs as a result of having cardiovascular disease. Disorders can be classified into following areas: mental, physical, genetic, emotional, behavioral, and structural. The definition of the dissociative identity disorder is a severe condition in which two or more distinct identities or personality states are present in and alternately take control of an individual. The person who takes a large part of everyday life in a dissociative identity disorder is called host, and partial personalities others. They find hard to realize that they have a problem. For them, their thoughts are normal and often blame other persons for their problems. They try to ask for help because of their difficulties with their personal relationship or their work. The causes of it. It is not entirely understood, but they frequently report having experienced severe physical and sexual abuse, particularly during childhood. Major trauma experience in the early years of childhood forms the basis for the dissociative identity disorder. This time it acts as a principle of the split in different personalities. Affected children suffer constant humiliation and danger which cannot escape. They can either ask for help, because the authors are almost always their closest relatives, demanding by threats to don't say anything. To overcome this situation, those affected develop a mechanism to escape the pain. They take off the real facts of his memory and believe that they do not form part of the situation. This process happens unconsciously and cannot be controlled. To overcome the continued trauma, those affected unfold in two or more identities. Each identity assumes certain functions in different situations and can reappear in a similar situation. The symptoms of these disorders are different. They can be mild or severe. Depression, images of memories of traumatic experiences like flashbacks, fear, episodes of self-mutilation and suicide attempts, aggression, headache, alcohol or drug abuse, eating disorders, obsessive-compulsive behavior, and perception of voices of the other personalities. The diagnosis of it as a dissociative identity disorder is linked to the numerous side effects. The diagnosis is often made late. At the beginning, it's usually done at treatment without success, for example, by a disordered limit of personality or depression. Since the appearance of the first symptoms until the correct diagnosis is they spend on average 6 to 7 years. Many affected are also afraid to tell their empty memory and rare events. For example, clothes in the closet that will be an important clue for a dissociative identity disorder.
I'm going to talk about the diagnosis part 2. Both adults and children are diagnosed using criteria from the Diagnostic and Statistical Manual of Mental Disorders. 1. Display two or more personalities that disrupt the person's identity, behavior, awareness, memory, perception, cognition, or senses. 2. Have gaps in their memory of personal information and everyday events, as well as past traumatic events. 3. Have symptoms that cause significant distress in working and social environments. 4. Experience disturbances that cannot be considered part of any accepted cultural or religious practices. For examples, in children, when imaginary friends or playing pretend cannot explain the symptoms. 5. have amnesia, or exhibit chaotic behavior that is not caused by alcohol or drug use. People with DID have an increased risk of self-harm and suicide. The right diagnosis and prompt treatment are essential and can be life-saving. Treatment. Once a person receives a correct diagnosis, treatment is an integral part of learning to live with DID. The treatment is long-term psychotherapy, and it has the goal of deconstructing the different personalities and uniting them into one. It focuses on educating a person about their condition, increasing awareness and tolerance of emotion, working on controlling a person's impulses, preventing further dissociation, managing current relationship stressors and daily functioning. Antidepressants, anti-anxiety drugs, and tranquilizers help control the mental health symptoms associated with evolution. DID appears almost always during childhood, however often remains hidden until adulthood. In its evolution, frequently appears oscillations. In some affected appear symptom stages, while in others they are permanently. Depending on stress and traumatic experiences, often symptoms increase. DID untreated becomes almost always chronic, although symptoms often diminish with age. However, also after years of treatment, patients continue to have often problems partly. Prognosis. Some symptoms may appear and disappear spontaneously, but DID doesn't resolve itself only. The degree of recovery depends on symptoms and personal characteristics, as well as the quality and duration of the treatment. Associated conditions. Post-traumatic stress disorder and several other mental health conditions are linked with DID. Other dissociative disorders include dissociative amnesia, depersonalization, acute stress disorder, anxiety, distress, and depression. Living with DID. People living with DID often refer to themselves as having alters or multiples. DID can have a significant impact on mental health, relationships, and a person's ability to work. Living with DID can be frustrating, scary, and insulating. Many people do not get diagnosed until they are adults, meaning they might experience years of frightening symptoms without knowing why. A person's alternate personalities may not always cooperate with each other. When another personality takes control, a person may wake up in an unfamiliar place with no memory of how they got there. However, the personalities may also work well together and help a person cope with everyday situations. Other people may not notice the shifts between personalities, as some people with DID may not display noticeable outward changes. Some people with DID may also suffer from social stigmas. Many people are only familiar with DID from what they have read in fiction or seen it in movies. People with DID do not inherently have a violent alternate personality. In fact, this is rare. Thank you for your attention.